And we have lost so many. In December, the state counted at least 3 separate weeks with more than 700 deaths, a mark not hit a single time during our summer surge. ABC 15's Mike Pelton with the concern coming from the front lines.
Talk to any nurse or doctor, you likely will get similar stories.
I would say we were averaging probably a death a shift.
Dr. Brandon Lawrence is an emergency physician at a Valley hospital.
Last week was probably the worst shift I've ever had. I was admitting people left and right, and we were just not able to decompress beds. I had admitted patients sitting in triage and waiting room chairs just with an oxygen canister and unable to put them on monitors because we didn't have any.
And as deaths have topped 700 a week, still no new mitigation efforts from state leaders. On Friday, I asked Department of Health Services Director Dr. Kara Christ.
If 700 plus COVID deaths a week does not warrant new mitigation strategies, is there literally any scenario at this point that you would recommend or the state would impose new or more stringent measures?
So that's a really great question. I think one of the issues is as we look around, a lot of the other states are experiencing the same thing.
Dr. Christ then comparing states with more and less mitigation than Arizona and stressing enforcement of existing measures. I also asked her why the state isn't doing what top doctors in our state are calling for. This week, a group of them from 5 different health systems calling for more mitigation, like a statewide mask mandate and stopping indoor dining. Dr. Chris says they are working with hospitals on resources and logistics.
One of the things that the hospitals don't really need to take into account is those long-term public health community impacts. So the impacts of what happens when somebody loses their job and can't get food, can't get housing, the mental health issues of that. And so we're trying to balance that from a public health perspective.
Really, the next few weeks are going to be very telling as if our medical system can handle the swell or break.
Dr. Lawrence saddened by some of the sickest patients.
You're stuck looking at this patient that is probably not going to make it, and the last thing you're saying to them, the last thing they'll probably hear is, hey, we're going to take care of you. It's terrible.
And not over yet. Mike Pelton, ABC 15, Arizona.